to give you a couple exercises that you can do to help prepare for your hip replacement surgery. So grab a pillow just to have for your head when we lay on your side. And these exercises should be pretty simple, straightforward, and you can do them in a series. So you do them one after the other to help kind of build up the strength. You can start by doing them a couple times a week, build up to 3 times a week, and maybe even 4 times a week if they're feeling really good. Choose a rep that feels really good that you can be consistent with. So maybe it's 5 reps, maybe it's 8, maybe it's 10. And when those repetitions get easy, then you can add on a few more at a time, but don't jump around. So stay pretty consistent for at least 4 or 5 sessions of doing the exercises before you change anything. So we're really going to work on alignment and setup so that you can just flow through these. So if you have your pillow, just have it placed by the side for later. And then whenever you're ready to start this video, you can just press play. And so in the future, you can just fast forward this part. All right, so come onto your back and we're gonna get started here. So lay on your back with your feet hip distance apart and just let your back settle in. You can do this on your bed, you can do this on the floor, but just give your body a chance to settle into this position. You're gonna bend your knees, not really tight, just kind of like a loose bend. And we're gonna start with just real simple bridging. So before we do that, just take your hands, make a little triangle, place it right on your pelvis, and just curl the tailbone and then reach the pelvis, creating a little arch. Just do this so that you can kind of start to loosen up the pelvis and get familiar with how that is moving. It just rocks back and rocks forward. So when you curl the tailbone under, you flatten your back, and when you reach it long and arch, you create a little lift under the low back. It might be very gentle, very small, and that's okay. Just get the pelvis moving. And then go ahead and just settle into a nice neutral spot. Bring your hands right by your side. Reach long through your fingertips so you feel like your shoulders are opening nice and wide. Take a minute to lengthen the back of the neck. If this is uncomfortable, take a little pillow or a little towel and prop under your head. If your head is like this and you can't lay flat, then you definitely want to support your head. So we're going to start with bridging. I'm going to do 10 just to show. So keeping the hips nice and neutral, you're just going to lift the hips up and then lower back down. Maybe you only have the strength to come up just a little bit, that's fine. And then just come right back down. Coming up as high as you feel comfortable today. Tomorrow might be a different story. And then just repeat. So you're keeping the shoulder blades open, connected to the floor or the bed. Just lifting the hips up. This is your bridging. So this helps strengthen the back of the legs into the seat and the hamstring. And maybe you feel like you can start coming up a little higher. So you're going to imagine that the knees are reaching in front of you long, the thighs are lengthening, so you get a little lengthen out of the front of the hips. And you're going to decide how many reps work for you. Again, maybe it's 5, maybe it's 8, maybe it's 10. So there's your first exercise. Those are bridging. So grab your pillow, roll onto your right side, and then you can use your pillow under your head. If you don't want to use a pillow, you can stretch your arm out or bend your arm and lay on it this way. You can also prop your head up with your hands. So for the sake of this video, I'm going to cue you to just have a little support for your head. And then you're going to stack your hips. And this is going to be the clamshell. We're going to start with this one first. So stacking your hips, meaning make sure that this left hip isn't way up by your rib cage. You're going to reach that hip long. I'm going to get rid of my ball. And then imagine that your hips are stacked. Like I'm going to put a little dowel through your hips. And they're both stacked right on top of each other, and pull the belly button in and up so it's not sinking down into the mat. And then from here, just gently open the knee up to the ceiling and then lower it back down. Keep the heels together, and you might find that you're only going to come a couple inches, and that's totally fine. What you don't want to do is roll that hip back. Keep the hip forward. You can put your hand on top of your hip and make sure that it doesn't roll back as you do your clamshells. So this is going to work the side of the hip. This is a muscle that's called the glute medius. That's really important for the recovery of your hip surgery. All the muscles are really important. That's why we're going to work all of them. So again, you can choose a number. Just find your working level here. I'll do about 10 reps. Good. Remember to keep the belly button pulled up off of the floor. And then we're going to move on. So the second exercise here on your side, you're going to straighten that top leg out and flex the foot. So you're going to reach through the heel, and the longer you stretch the leg, you should feel that top hip kind of stretch away from the ribs. And this is your up and down. You're just going to stretch the leg up and then point the foot and bring it back down. Flex and lift it up and point and bring it down. The flex and point really helps you get the length into the leg, and you're not bringing the leg up so high that you lose the support of the hips and the belly button in and up. So keep it long versus higher. So flex and really reach like you're trying to reach for that wall. Flex and point as you come down. So I'm keeping my belly button pulled up off of the floor. And again, you're not rolling the hips back. You're keeping them very stacked. And we'll just do one more. Now keep the foot pointed, and you see how this leg is in line with the hip, so I'm not lowering it down or having it up too high. It's right in line with the hip. It's hard to just hold it in that position. You're going to make little circles here forward. Think of like a teacup or salad plate size, very small. This is hard to hold the leg in this position, so maybe 3 reps is where you're going to start. So circle forward and then circle back. Feel the back of the seat help you circle the legs back, and just keep pointing and stretching the leg nice and long. Good. And then bend the knee and just take a little break. So we're going to roll on to the other side. So take your time to do that. You at home can just roll on your back and roll on to the other side. I'm going to face the camera. And we're going to do the same thing over here. So stacking your hips. Keeping the belly button pulled in and up. Reach that top hip away. And start with your clamshells. So just opening the knee up. And remember, you're not going to go very far because you don't want this top hip to roll back. You want to keep it nice and stacked. The belly button is stabilizing in and up. You are preparing for hip surgery, so you really want to get in touch with your body. You want to learn when you're compensating and when you're not. So ideally, we want to really isolate the right muscles. We don't want to compensate. We want to use our abdominals as much as we can to support our movement. After surgery, your gait is impaired. You're really bearing a lot of weight on your non-operative hip, so you really want to deepen those abdominals as much as you can. Start pulling the belly button in and up and get used to that. Good, just do a couple more of these little clamshells to warm up. Feeling the side of the hip. It's right behind that hip bone, that greater trochanter. That's where that muscle is that you're working. So straighten out that top leg, flex through the foot. And again, you're just going up and point to reach it down. So the longer you reach, the more length you get out of the hip. And these are small. Good, you're thinking more length versus height. You're working from the back of the hip, so you can put your hand on your hip. Maybe you can find your hip bone and then bring your hand right behind it, and it should feel like a little dip in there. That's where that muscle is, that glute medius, and that's what we're working here. That muscle really helps support you when you're walking. It keeps your hips from dipping down. So typically prior to hip surgery, your gait gets a little compromised. So this muscle is really important, so it can help hold and support the hips up when you walk. So keep the leg nice and pointed. Remember your circles, tiny little circles like you're stretching for the wall. decide how many you want to do. This is going to really fatigue the hips because you're doing all the exercises in a row. Feel free to pause the video and just take a quick little break and get back to it. So take it back. You're going to learn these exercises. They're not going to change. So you can kind of know when you need a break and you'll work into it. So we're taking those circles back and then just bend the knees and take a little break. So we're going to change the position one more time. So you can sit up, just take your time. We're going to come back onto your back. And lay all the way down onto your back. This is another really important exercise. You're going to be doing this out of surgery, and you're going to really want to do it before surgery. So you're going to flex that foot. You're going to pull your belly button in nice and tight, and you're going to do a single leg raise. You're going to come up so that this thigh is meeting the other thigh and come right back down. Now use your belly button in and up, all your abdominals to help pull that leg up. This gets very heavy. So the more you can do this and prepare before surgery, the easier it's going to be after recovery. And a lot of times you're going to notice that you have to stop, let the leg fully release and relax, and then pull the belly button in again, flex the foot and lift the leg up. Come back down, and then maybe you release all of your effort, and then maybe you come back in, you tighten this quad, pull the belly button in and lift the leg. So for the sake of the video, I'm just kind of showing you how I'm going up and down. And then you're going to stop halfway. So if you're doing 10, just do 5 with the flexed, and then point the foot and do maybe 5 more with a pointed foot. You're going to get a little bit more length out of the top of the hip. These are very hard after surgery. So I really want to reiterate the importance of these going into surgery. This is working the front of the hip, the muscle, the hip flexor that helps lift the leg up and forward. So that's going to be really important that you're strengthening that. Switch sides. Start with that flex foot. Stretch the leg long. Pull the belly button in like your pants are getting really tight, and you're going to float that leg up. Same thing over here. And if this speed is too fast, and it might be, probably is, just take a break. Go slow. Get your reps, and then keep that the same. So when you do this exercise in a couple days, you're going to do the same amount of reps until it gets really easy, and then you feel really comfortable and confident moving on. And then I'm going to stop halfway. I'm going to point my foot and lift the leg up and down. The belly button is pulling in. I'm imagining my pants are getting really tight. And that's going to help me cinch the waist and use all of these stabilizing muscles in my pelvis so that the pelvis isn't moving around. Learn how to feel the stability of the pelvis. Good. And that's the last one there. We have one more exercise, and then you're going to be done. So you're going to roll on to your stomach. So remember to tighten up your tummy muscles, scoot yourself over in your bed or on the floor, and then roll with one motion, shoulders and hips. You're going to roll at the same time, and then roll all the way onto your stomach, and just take a minute here. You might need a little pillow under your chest or your head, and that's fine. Just take a minute, take a deep breath here. And just settle in. So you're going to take the pelvis and curl it under like you're connecting the pubic bone to the mat. You're going to pull the belly button off of the floor, up off of the bed. You're going to straighten your legs so long like you're trying to reach your big toes for the wall behind you. And if you can, you're going to pull your chin down and rest your forehead on your hands. Take your right leg and lengthen it, and then lift it up from the hip. Lower it back down. Do the same amount of reps on each side, and we're just going to focus one side at a time versus alternating. So when you lift the leg, make sure you're not bending the knee. You want to straighten the leg, then lift. Stretch it long and lift it. So you're using the seat to lift the leg. Keeping the belly button pulled off of the floor, like you want to slide a little sliver of paper under your belly button. This should be hard. You don't want to arch through the back. And remember, you're not lifting your leg very high. Switch to the other side. So pull the belly button off of the floor, stretch the legs long, lift it up. Don't bend at the knee. So think about reaching the leg long versus high. And you're using the seat, the big glute max muscle. This is the hip extension muscle. They're all important. They're all important for recovery and functional use. Good, so stretch it long and then lift it. Make sure you're lifting from the seat, not bending from the knee. If you have someone to watch you, they can give you a little feedback. Just do one more, or maybe you're done. And then just take a little break from there. Slowly roll onto your side. Slowly come up. Sit up nice and tall. Get yourself together, and there is your flow. So I went quickly for the sake of the video, but please just take your time, find what works for you. But these exercises consistently can really help you get ready for your hip replacement surgery. I hope this helps. Take care.